Ladies and gentlemen, welcome to my second podcast, Fascination, Health Psychology. In this podcast, I would like to focus on depression. Depression is probably the most common psychological disorder in industrial nations. And studies from the World Health Organization show that around 1/3 of the population in Western cultures have psychological disorders, and especially depression. Now, what are the symptoms of depression? Symptoms of depression could be, for example, problems in concentration, remembering details, making decisions, fatigue, even chronic fatigue, feelings of guilt, feeling of worthlessness, helplessness, pessimism, hopelessness, insomnia, early morning wakefulness, or even sleeping too much, loss of interest in things once pleasurable, including sex, overeating, or even loss of appetite. Further symptoms are or could be aches, pains, headaches, cramps that won't go away, digestive problems that don't get better even with treatment, being sad, anxious, or having empty feelings. And one of the most crucial symptoms are suicidal thoughts or even suicide attempts. We speak clinically from a depression if the symptoms are there for at least 2 weeks. So you should have a minimal duration of 2 weeks. If you realize that one day you have these kind of symptoms, or if you know somebody who has these kinds of symptoms, then you should consider going to a psychiatrist or a psychotherapist to get the suitable treatment. Now, there is quite a kind of a taboo going to a psychiatrist or a psychotherapist because people say, I am not crazy, why should I go to a psychiatrist? Well, actually, I am working in a clinic for psychiatry, and we see all kind of people there. Judges, policemen, lawyers, professors, teachers, pilots. So actually everybody can develop during his or her life psychological disorder, and especially depression. And it is not a problem at all to get the plausible treatment. So if a person has problems with the knee, problems with the bone, then he or she would go to an expert for this disease. If you have problems with your heart, your stomach, they would go to a cardiologist or a physician for internal medicine. And therefore, if you have a psychological problem, you feel depressed or anxiety, then it is really reasonable to go to a specialist in this field. Now, the problem is that many times you have in Germany waiting lists for weeks or even months. And especially during vacation, during Christmas, depressive rates gets really high, and even suicide attempts get higher. So if a person feels that he or she is depressed and have strong feelings of or thoughts of suicide, then the solution would be to consult a clinic of psychiatry, and then a physician will then look at you and then decide if staying in psychiatry at the station would be a reasonable solution. Now, a lot of people are also afraid from psychiatry, so they think, maybe you saw the movie One Flew Over the Cuckoo Net with Jack Nicholson, And some people might think that in psychiatry people are kept and they get this funny jackets and they are getting drugs or they are sedated or they get electroconvulsive therapy as punishment. These things which we see in the movies has nothing to do with modern psychiatry. Actually, if somebody is have suicidal thoughts or suicidal attempts, he or she can go to a psychiatry and tell about their complaints, and then they will stay in the psychiatry only as long as they get stable again. And nobody is interested in keeping a patient longer in hospital if it is not really necessary, because there is a long waiting list. So once a patient gets stable, then he or she, in agreement with the physician, will go out, and then afterwards he or she should then consult a psychiatrist and a psychotherapist. Because in Germany, the psychiatrist is giving the medication and the psychotherapeutic sessions are done by a psychotherapist. So these things are actually in Germany divided. And usually a patient would need both. It would need psychopharmacological treatment and psychotherapeutic sessions. Let's go further. Another interesting question is, how do people actually develop depression? And there is pioneering studies from Seligman, which is on learned helplessness. This experiment was as the following. You see here a box with a dog in it, and this box has part A and part B. And in the first part of the experiment, this blue wall between part A and part B is high and dividing this box in two rooms. Now you have your coordinate system. On the x-axis you have the time, and on the y-axis you have the coping behavior of the dog. So the more electroshocks the dog gets, the more the dog tries to overcome the electroshocks. He tries to jump over the wall, tries to find a way how to go out. So the coping behavior increases and increases and increases, and then reaches a plateau, and then the dog starts giving up. The coping behavior gets less and less and less and less, until the dog goes to a corner of the cage, crawls together and makes like that, and doesn't do any coping trials anymore. This elevated part of the curve is called the reactance phase, and the lower part of the curve is called the phase of learned helplessness. If you remember the first lecture, the first podcast, you can see now an interesting similarity. In this elevated part, the reactance phase, in the body of the dog is produced a lot of adrenaline and noradrenaline, whereas in the second part, the adrenal gland produces cortisol, which suppresses the immune system and destroys the cells in the hippocampus, which is responsible for memory. Now, if you take a dog, once he arrived in the phase of learned helplessness, and put the dog 2 weeks later in a box where the blue wall is very low, actually now the dog could easily jump over the wall. But what do you think will the dog do? Will the dog jump over the wall? No, he will not. Again, as 2 weeks before, he would go again to the same corner, crawl together, and do like that, and will not do any trial to overcome the electroshocks, although the dog could easily jump over the blue wall. However, if you take the dog outside the experiment in the reactance phase, and 2 weeks later put him in this box, within few seconds the dog will jump over the blue wall and will overcome the electroshocks. Now the behavior and the physiology of this dog resembles in many ways depressive patients. In a lot of my patients, we realize, we see that once in the lifetime they were in a situation where they were confronted with learned helplessness. And the problem is that they are generating this previous experience of helplessness on all new situations. Now imagine that refugees who came from a country where they were suppressed or tortured or insulted, that they are or could be in a situation of learned helplessness, and then generalize this previous experience every day on your presence. Now it is really important that even if once in your lifetime you were in a position of a victim, that you won't stay your whole life in this position, in the role of the victim. So even if once in your lifetime you were in a role of a victim, be aware of not staying the rest of your life in this role of a victim. And I know several patients who once were a victim and somehow also enjoys in staying in the role of the victim, because they will get a lot of empathy, a lot of support, but they will not really develop their energy and their life and their career as if they would overcome this state of learned helplessness. Let me give an example. I had once a patient who was working in a bank. He was around 35 years, and when he was a small child, his father many times told him sentences like, "You are worthless, you are rubbish, you are not good enough." Now the father treated his son in this way because the father of the father was a teacher in a Nazi training center. So because the grandfather treated in a bad way the father never learned a better model to treat his own son in a better way. So actually the father was not really a bad guy, but because of his biographical experiences, he was not able to treat his son in a better way. So therefore, if for example your parents insulted you a lot or hit you a lot or used violence against you, you should critically reflect your biography and your education and decide which things from your education would you like to use on your own children and which things would you like consciously to stop them and do it in another way. So let's come back to this patient. So this patient, when he went to school, he was very shy, he was very anxious, and then therefore he was also a victim of mobbing. And the pupils in his class were laughing at him, mobbing him. And then he says when he was around 10 years old, there was a situation when a pupil put him on the floor, hit him, and the whole class started clapping. And he said that this situation crushed his self-esteem, broke his self-esteem. And then from his 10th year until today, he is in a permanent state of learned helplessness. So, because he is generalizing this previous experience of helplessness on the present, he is doing the following. If he goes to the bank and his colleague asks him, how are you? How was your weekend? He said, it was okay. And he uses communication killers. He don't want to go in a long communication because he thinks that if people would know more about him, then they would use this information against him. And therefore, because he's afraid of social context, he is isolating himself. And this isolation gives him on the short run a reduction of fear, but on the long run, it produces depression for him. So what would be the solution? The solution would be that we should learn to differentiate the past and the present. Do not generalize easily previous negative experiences and helplessness every day on your presence. So if you have a new situation, then look at the possibilities which you have in this situation. Maybe you have other circumstances than in the past, other situations, other possibilities. Maybe you have also other resources, other people who could help you. And I also recommend to take a piece of paper and a pen and write down which situation do I now have, and not easily generalize previous bad experiences on your presence, and be aware of not sticking in the role of the victim the rest of your life. Another thing is that depressive thoughts changes your brain. Now, from brain studies, it is known that depressive patients have deficit in the serotonin level in the brain. So in the brain, there is a neurotransmitter called serotonin, and it is usually lowered in patients with depression. So therefore, most antidepressive psychopharmaca have the function of increasing the serotonin level in the brain. So most antidepressive psychopharmaca are so-called SSRIs, which stands for selective serotonin reuptake inhibitor. What does it mean? So here you see the synapses, and in the presynaptic neurotransmitter serotonin is produced, and the serotonin can dock on the serotonin receptors. And then the serotonin can get reuptaked again, and the medication, here in blue, stops or inhibits the reuptake of serotonin, so that serotonin will get for a longer time used in the synapses. So the antidepressive medication increases artificially the serotonin level in the brain. So, as I said, some people assume that in psychiatry, people are only getting sedative medication. This is not true, because a lot of antidepressant medication actually increases the activation of the brain. So there are antidepressive medications which has a rather sedative effect and support sleeping, but there are also antidepressive medication which has the opposite effect and activates you and increases your motivation, for example. Now, here you see, again, a picture of a neuron, and what is really important is that taking antidepressant medication alone is not sufficient. So if a patient is depressive and takes antidepressive medications, but still thinks in a bad way on himself, his future, his past, and gets accustomed in diminishing his self-esteem, then this person has so many synapses for the depressive way of thinking that he's actually an expert in being depressive. So therefore, we train patients to stop thinking in a depressive way and evaluate the thoughts and think if there's maybe another perspective on things. To change depressive way of thinking into antidepressive way of thinking. And at the beginning, this was with a lot of effort combined, but once you do that a lot, then the synapses for the depressive thoughts will fade away and the synapses for positive thinking will get enlarged. So, again, let us repeat the fact that depression and depressive thoughts can lead to neuroplastic changes, and changing depressive behavior and depressive thoughts also induces neuroplastic changes in the brain. So, if, for example, you are not isolated, but be aware of social context, laugh with other persons, give compliments, then this behavior would very normally also let your brain produce serotonin. If you are most time of the day have thoughts like I'm not good enough, I'm worthless, I failed in my life, a lot of people were very bad to me. If you have a lot of time this kind of thoughts, then your brain will not produce serotonin. However, if you think, for example, okay, maybe in my country I had a career and I had a good job and so on, and now I lost everything, but I can start something better or something different, and I'm living here in peace and I don't have to be afraid of my life, and I have actually a lot of possibilities here, then this positive way of thinking again will start to produce serotonin in your brain. Another thing is sport. If you do any kind of sport which increases your heart rate for around half an hour, then this again also will increase the serotonin level in your brain. So let's come to the conclusions. We talked about the several symptoms of depression, and a very important paradigm is a paradigm of learned helplessness. So even if once in your life you were in the role of a victim, be aware of not sticking to this role. Taking paper and pen and writing down the new possibilities which you have so that you can systematically find solutions for the situation you have, and not easily generalize previous helpless situation on the presence. Right. I would like to thank my colleagues who supported me in organizing this podcast, and I would like to thank the Department for Integration and Gender Equality at the City of Reutlingen for supporting this project. Thank you for your attention. Goodbye.